So guys, in this video we are going to talk about Raynaud's disease and Raynaud's phenomena. First of all, we will see what is the Raynaud disease, what is the definition of Raynaud disease. Then after we'll see the etiologic factor of Raynaud disease and some pathophysiology of the Raynaud disease. And at last we will see the treatment of Raynaud's disease and Raynaud's phenomena. So guys, let's start with the definition. Raynaud disease is a kind of episodic vasospasm which is characterized by pallor, cyanosis and pain in the small artery and arterioles of the extremities. So guys, what is the Raynaud disease? It is kind of an episodic vasospasm of small arteries and arterioles of the extremities. Due to this small arteries and arterioles vasoconstriction, there will be some cyanosis in the extremities. So there will be pallor, cyanosis and pain. So this is the basic definition of Raynaud disease and Raynaud's phenomenon. It is for both of these. But there is a little difference in between Raynaud disease and phenomena. And that is, in disease, there will be no change in the vessel wall. Whereas in the phenomena, there will be some changes like fibrinoid swelling, or some inflammation in the vessel wall. And one more difference is there, and that is Raynaud disease. It's idiopathic. We don't know the cause why it happens, but some triggering factors are there, such factors like cold, environment, emotional stress, or some drugs. Whereas this Raynaud's phenomena is having some diseases, like it is a secondary. So diseases like scleroderma, SLE, Berger's disease, other diseases like multiple myeloma, and some drug intoxication also is there. So basically we can say that the Raynaud phenomena is having some underlying cause like scleroderma or SLE or Berger's disease or multiple myeloma, whereas this Raynaud disease is idiopathic. We don't know any cause, and there won't be any change in the vessel walls, whereas in the phenomena there will be some fibrinoid swelling and some inflammation of the vessel wall. So guys, this was some definition and some of the cause and little bit difference between the Raynaud disease and Raynaud's phenomena. Now we will talk about little bit pathophysiology, that how it occurs, what is the process and how this cyanosis occur. Just suppose there is some triggering factors like cold temperature or cold environment, some stress, some emotions, some other drugs, and because of this there will be some vasoconstriction of the small vessels because of ANS, autonomic nervous secretion. And this autonomic nervous system and this vasoconstriction will cause vasospasm of the blood vessels, small arteries of extremities, and because of this there will be a white and blues, or like just suppose we will divide it in two parts. First of all, we'll see that white appearance of the fingers, that is due to vasoconstriction because of local syncope, because the blood is not going over there, and the patient will feel some tingling and numbness in the fingers. Then after, there will be some bluish area, and this is basically due to two things. And first of all, there will be reduced hemoglobin because of reduced perfusion of the area of the fingers because of vasoconstriction, and there will be some stasis. So the person will feel some burning sensation in the fingers. And this process is called as a local asphyxia due to this vasoconstriction. Now there is a burning sensation and bluish area on the fingers due to this vasoconstriction. Now here there is a differentiating, like how we can differentiate from the Raynaud disease and Raynaud's phenomenon. So guys, I already said you that in the disease there will be no change in the vessel wall, whereas in the phenomena there will be some changes in the vessel wall. So if there is a normal blood vessels, a patient is having if a normal blood vessels, then after giving proper warmth or after giving proper heat to the affected area, there will be reperfusion and the skin of that area will be pink in color. That is a local recovery. But if we don't provide this heat to the affected area, then there can be a possibility of ischemia and gangrene also. That is hyperemia, and long standing it will be like necrosis. But if the person is having abnormal blood vessels, or if the person is having Raynaud's phenomena, abnormal blood vessels, then there will be ulceration in the affected area, and that is called as a local gangrene. And that is called as a Raynaud's phenomena. And then after we will look after some secondary causes, like why it happens, because the Raynaud phenomena is having some other diseases. Because of that disease, the person is having this phenomenon. So we will look after scleroderma, we will look after SLE, we will look after some Burgers disease or multiple myeloma, or the drugs which patient is taking. So guys, one more thing I forgot to tell you about this Raynaud disease and Raynaud phenomena, and that is it happens mostly in females, young females. This thing you have to remember mainly. I'll repeat it. First of all, it is episodic vasospasm of the small arteries. It happens in the female mostly, and the Raynaud disease is idiopathic, whereas the Raynaud phenomenon is kind of having some underlying cause, like it is secondary to some other causes. So now we will talk about the treatment options for the Raynaud disease and Raynaud's phenomena. So guys, we already saw that there is factors like cold temperature that is providing some vasoconstriction, and because of that the person is having cyanosis, pallor and pain in the affected area. So in the treatment we will provide proper warmth to the affected area. Then after we'll do some stress management programs. we will find out the reason of the stress and we'll try to solve the problems. Then after, if the person is smoking, then he should stop smoking. There is reason behind it, and that is, in smoking there is a nicotine which is a vasoconstrictor. So this nicotine will worse the condition. That's why the patient should stop smoking. Patient should avoid the ingestion of caffeine, because caffeine is also vasoconstrictor. And as a treatment, we will give some drugs like vasodilating drugs like nifedipine or diltiazem. Patients should avoid drugs like beta blockers, OC pills, and ergot drugs, which we treat, which patient use mainly in migraine. And if all this don't work, then we can go for surgical approach also. And in surgical approach, we mainly do sympathectomy. So guys, this is some basic treatment options for Raynaud disease and Raynaud phenomenon we are having. So guys, what we studied in this today's topic, that is Raynaud disease and Raynaud phenomena. Both are different because in disease there is no change in the vessel wall. There is no change in the vessel wall, whereas in the phenomenon there is fibrinoid swelling and inflammation of the blood vessel wall. So this is basic difference in between both of these, and the rest of the things I already taught you. Please study carefully and keep in mind that what is the difference between Raynaud disease and Raynaud phenomena. Thank you for watching this video. We'll meet in the next video.